be walking you through the process of anesthesia in small ruminants, specifically sheep and goats. Anesthesia in these species can be more complicated than in dogs and cats because of their unique digestive system, their tendency to regurgitate, and their sensitivity to certain drugs. So it's really important to understand each step from patient prep all the way to recovery.
The first step is to perform an all-around routine physical exam of the sheep or goat, making sure that the vitals correspond to the ones on the screen.
Small ruminants like sheep and goats are considered more sensitive patients when it comes to anesthesia. They constantly produce large amounts of saliva and gas due to rumen fermentation, which can make them more prone to aspiration or bloat while under anesthesia. Because of that, airway protection and patient positioning are key throughout the process. Also, whenever working with food-producing animals, it's very important to think about the drug withdrawal times for each medications before using them. Before anesthesia, you fast adult sheep and adult goats 12 to 18 hours. This reduces the size of the rumen and helps limit gas buildup. However, neonates shouldn't be fasted for more than 4 hours since they're at risk of low blood sugar. Late pregnant animals like Zoopy shouldn't be fasted for more than 4 hours. During prep, it's important to check all the equipment before induction: the anesthetic machine, the circuit, the ventilator, and the endotracheal tube. Small ruminants under 150 kilograms can go on a small animal anesthetic machine, but anything heavier should be placed on a large animal system. Most small ruminants are naturally calm, so heavy pre-meds aren't always necessary. But if the patient is nervous or aggressive, you can use mild sedation. They're very sensitive to xylazine and only need about 1/10 of what a horse would get. You should avoid giving it too quickly and always have reversal agents on hand. Sheep in particular can have dangerous pulmonary reactions to xylazine or ditomidine, so it's important to use them cautiously. Xylazine also increases urine production, so it's not ideal for blocked goats. Morphine also provides great pain control, and NSAIDs like meloxicam are also used commonly for analgesia. We never use anticholinergics in ruminants because they don't reduce the salivation. Instead, they make it thicker, which can block the airway. Induction should be done carefully because ruminants are more likely to regurgitate than other animals. Your main goal is to protect the airway as fast as possible. Most small ruminants can be induced next to the surgery table using IV agents or directly on the table if they're small or weak. Keep them in sternal recumbency for intubation when possible. This helps saliva drain out and reduces the risk of aspiration. If regurgitation happens, lower the head immediately so fluids can drain from the mouth instead of flowing towards the lungs. Intubation can be tricky because their mouths are small and the distance to the larynx is long. The back of their tongues is thick, especially in sheep and goats, which makes it hard to see the airway. Using a long laryngoscope and a stylet as a guide really helps. Once the tube is in, the cuff should be inflated to seal the airway, just like you do with dogs or cats. If the animal isn't intubated, like for very short procedures, make sure their head stays lower than the throat to prevent aspiration. Once intubated, you can maintain anesthesia with inhalant gases or use total intravenous anesthesia for shorter procedures. For long surgeries, inhalants like isoflurane are best because they allow better control over anesthetic depth. Ruminants usually maintain stable blood pressure, but they often hyperventilate. This can cause low oxygen levels, so using a ventilator or giving supplemental oxygen is very helpful. For short procedures under 20 minutes, IV double drip combinations can be used to maintain anesthesia. During surgery, always position the animal so that the head is lower than the throat, so that the saliva and regurgitated material can drain out easily. Place padding under the body to keep the animal comfortable and prevent nerve or muscle pressure injuries. Fluids and supplemental oxygen are recommended for longer procedures to support circulation and tissue perfusion. Because these animals lose heat easily, keep them warm and dry throughout the surgery. Monitoring anesthesia in small ruminants can be difficult without proper equipment. Using a pulse oximeter and other monitors is really helpful. If the plane of anesthesia is too light, you'll see chewing, blinking, nystagmus, or muscle tone. If it's too deep, you'll notice dilated pupils with no reflexes, slower heart rate, and shallow or paradoxal breathing, where the chest moves inwards during inhalation. Always watch carefully and adjust as needed. After surgery, place the animal in sternal recumbency. This position allows them to release gas as they wake up. If regurgitation occurred, keep the endotracheal tube cup inflated or only partially deflated when removing it. This helps prevent aspiration. Wait until they swallow or cough before extubating. Hypothermia can slow down recovery, so keep them warm and dry. As they wake up, they'll pass through the anesthesia stages in reverse, but usually more calmly than any other species. Once the animal is awake, alert, and breathing normally in sternal recumbency, it can be left unattended. Bloat is the main concern during recovery. Watch for a tight and distended abdomen. If bloating does happen, you can pass a stomach tube to release the gas. Once they're fully recovered, food and water can be reintroduced until the veterinarian gives other instructions. To sum up, anesthesia in small ruminants requires careful planning, gentle drug use, and constant monitoring. Their rumen function, saliva production, and risk of regurgitation makes them more challenging than typical small animals. But with proper prep, airway protection, and patient positioning, anesthesia can be performed safely and smoothly.
Attached are 2 charts of the correct drugs and all the dosages.